After this surgery began, I started getting the impression that Dr. Duntsch didn't really know what he was doing. Everyone involved in that case, from the scrub techs to the x-ray tech to myself to the anesthesiologist, gave each other looks many times during that case because we just didn't understand what he was doing. Tragically, what happened in the end is Florella Brown died less than 24 hours after her surgery. The following day, Dr. Duntsch was set to perform a spinal fusion on Mary Eford. I was the operating room nurse for patient Mary Eford as well. As he was working and he started putting in screws, which are meant to go into the spine, every single person in that OR told him that's in soft tissue. And his response was, I know where it's at, I can see it, it's in the spine. The next day, a new surgeon was brought in, Dr. Henderson, and he was going to perform a second surgery on Mary Eford to hopefully repair what Dr. Duntsch had done.
When I got to the operating room, the operative field kind of looked like a bomb went off. There was a loose screw that was not stabilizing anything. The screw was penetrating the spinal sac. There was spinal fluid leaking out of the sac. We discovered that the L5 nerve root had been amputated. Discovering what he had done and not done, I was more concerned that he was an imposter, that he was not a neurosurgeon, that he was not a surgeon. He may not even be a doctor. That's how bad this was.
Now, Kyle, you say that Dr. Duntsch left the room with patient Mary exposed on the table. Does that ever occur in any other procedures you've been involved in?
No, it's really rare for that to happen. In an emergency situation, it might have, but he did that because he didn't take care of Florella Brown before starting surgery on Mary Eford.
Right. And you say that when Dr. Duntsch came back into the OR, you told him the screw was in the wrong place. How did he respond?
Well, everyone in the OR was telling him it was in the wrong spot. I mean, anyone who's been in the OR for a day can look at an x-ray and see when it's sitting in soft tissue. And his response to us was, I'm looking at the screw and it's sitting in the spine.
So he just said the x-ray was wrong.
Yeah, he said the x-ray was lying and we were all mistaken.
I'd like to have Dr. Henderson walk us through exactly where Dr. Duntsch missed the mark during Ken's surgery, a procedure he claimed would give Ken more stability by adding implants. And I have a spine model to show us where Dr. Duntsch should have operated on Ken versus where he actually did cut in to Ken. Now, Dr. Henderson, help us through here. He was supposed to go in through the L4-5 space, correct?
Correct. He had stenosis at that level, which is a constriction of the nerves inside the spinal canal.
The proper procedure is to put an implant in here.
You put a cylinder type device in there that actually distracts the bones.
Right.
And makes more room for the nerves inside the spinal canal.
Yeah. We're looking at the x-ray now, and I believe this is after Ken's first procedure. What are we seeing here?
Anything that's dark on that x-ray is bone. Or in the case of the two images on the right, those are metal. So you can see that those metal implants, those two circular implants, are in a very bright spot, and that is fatty tissue.
How do you get to become credentialed as a neurosurgeon in a hospital and not know that those implants go in the spine and not in the fatty tissue next to the spine?
I mean, I seriously was concerned whether or not he was a trained neurosurgeon, whether he was a surgeon at all, and whether or not he'd even gone to medical school.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.